In 2023, about 1.4 million Minnesotans were on Medicaid. This would include children, people with disabilities, and seniors. At the start of President Trump's term in office, he revoked an executive order that President Biden had issued in 2021 to straighten Medicaid and the Affordable Care Act. The future of Medicaid in Minnesota is unclear. Here's what Minnesota Senator Liz Bolden has to say.
So we are, there's a lot of uncertainty around what is happening at the federal level, confusion and chaos. And, in my opinion, that is the intention. So when we talk about Medicaid, I mean, that is a program that is administered by the states and the counties, really, but depends on funding from the feds, from the federal government.
What are consequences to this chaos?
I mean, that's the bottom line. It would mean people will lose access to healthcare. They won't go to the doctor. They will certainly, they won't have access to those preventative cares. And it's not what is best for the system, because ultimately those costs are going to happen regardless. And so people are going to go without care.
The senator says that would mean kids who cannot make it to well-child checkups and people who push off going to their doctor for crucial appointments. That means more Minnesotans can end up in emergency rooms instead of doctor offices. That is a big risk for the state of Minnesota and its health infrastructure. Can you think of any other risks that will arise from cutting Medicaid? Be sure to comment.